So disc replacement surgery is spine surgery, meaning that we are working very close to the spinal cord. There's some very expensive real estate in your neck that we have to work around. So I would say it is a serious surgery. It's nothing to be taken lightly. But that being said, it's a very routine procedure that we do a high volume of. It takes about an hour for one level arthroplasty, and it's done as an outpatient. So you come in the morning, you have your surgery, usually you're home by the afternoon. The recovery time is usually not bad. The post-op pain is usually, there's some medication we give you, but you're up and moving that day. You're up and doing normal activities like walking around, maybe going to dinner within a week or two. Sometimes you get a little bit of a sore throat afterwards. In terms of return to work, everyone's work is a little different. Everyone's recovery is a little different, but typically if you do desk type work, you can be back to work in a few weeks. If you're doing heavy construction work or heavy duty lifting, that can take a little longer. We typically get patients into physical therapy afterwards, after a few weeks. But overall, it's a pretty quick process in terms of recovery.